How do you get your family members to hear you better? Well, the main thing is communication strategies. You want to communicate with them the same way that you would play catch with them. So if the two of you are in different rooms, you can't play catch because the ball can't go through the wall, right? Well, same thing with your voice. If you are in two different rooms, they will not be able to hear you. Sometimes, even if both parties have normal hearing, they may not be able to hear you. So get up and go into the room that they are in. Make sure you have their attention. If they're doing something else and you're playing catch, you wouldn't throw them the ball, right? Because they're not paying attention. They're not going to catch the ball. Same thing when communicating. If they're writing, reading, watching TV, doing the dishes, cooking, folding laundry, if they're doing something else, they're not attending to you or listening to you. And so it's important that you get their attention before speaking so that you know that at least their attention is on you. And now it truly is just a hearing issue if they don't understand you. Also, if there's a lot of background noise, you want to try to reduce that background noise. Remember, if we're standing in a field and everyone's throwing a ball at us, how are we supposed to catch the one ball that we want to catch, right? It's really difficult. Same thing when we are in a noisy environment. If there's a lot of background noise, it can make it very difficult for our brain to filter that noise and focus on what we want to hear. Now, when we're younger, our brain does a much better job of doing this. As we get older, our brain's ability to filter and focus begins to decline. That's why it's very common. I'll see patients in their 60s and they'll say, I'm having trouble hearing in background noise, but I hear fine and quiet. And sure enough, their hearing is normal, but their brain's ability to filter and focus has begun to decline. And that can be helped with auditory training. So don't feel like there's nothing that can be done for that. So those are just some tips and tricks for communication strategies. Of course, if you know one ear is better than the other, then yes, speak on that side of the ear. Getting their attention is key when communicating with someone with a hearing loss. And first and foremost, just be patient, be understanding, be empathetic, but be firm and letting them know how important it is that they get their hearing evaluated and treated. Just because they're having difficulties hearing does not mean they need a hearing aid. That is one of the biggest misconceptions people have. It's so important to get evaluated to determine, one, do they have a hearing loss? Because they may not. And it may be their brains having difficulty processing sound. And again, auditory training is appropriate. But if they have a hearing loss, what's causing the loss? And then that will determine the treatment, right? Maybe it's a hearing aid. Maybe it's going to an ear, nose, and throat doctor because there's fluid behind the ear, or there's a growth, or there's a tumor. There's so many reasons that can cause hearing loss. Do not assume you just need hearing aids. All right, friends, I hope that was helpful. I'm Dr. Maria Morrison, audiologist. I'm your expert in hearing healthcare, and I'll see you next time. Bye-bye.